Friends, good evening and welcome to our award ceremony. This is the evening where we celebrate what is best about the RUH. Every month I get to give out the Team of the Month awards and also my Customer Care Awards. Those are the highlights of my month. Tonight's award ceremony is the highlight of my year. Some of you will know that this will be my last award ceremony, but I wanted to take this opportunity to say a really special thank you. Thank you on behalf of the board, thank you on behalf of your colleagues, but most of all, thank you on behalf of the patients that you care for. Life in the RUH is never dull, but I know that you'll continue to go the extra mile, as you have done for the last 12 years, to give our patients the best possible care. But tonight is your night off, and I'm sure you'll have a fantastic one.
The name of our team is Project Induction of Labour. We won Team of the Month for implementing a new service associated with our induction of labour. This process began wanting to streamline the induction of labour service, having a high quality, safe project that we could have for our women. It was a huge undertaking that's taken many years, but one of the priorities of this service was to introduce a new device that was drug-free and that was wanted by people, and that's been recommended by our National Institute of Clinical Excellence. This device is a cervical ripening balloon which has revolutionised the induction of labour process. It's streamlined it, it's made it quicker, it's made it safer, and it's been driven by patients and staff.
The name of our team is the Healthy Choices Project. We won Team of the Month for trying to tackle smoking and excess alcohol intake in patients being admitted to hospital. Smoking and alcohol are big drains on the NHS. It costs the NHS about £6 billion a year, but more importantly, it shortens patients' lives and makes their lives very unhealthy. So what the service did was to identify patients who came into hospital who were still smoking or drinking more alcohol than they should, and then this team would go and see them within 24 hours and deliver an intervention to help them stop smoking or to cut down their alcohol intake and refer them on to the appropriate community services when needed. We screened thousands of patients and we tackled hundreds of patients who were smoking or still drinking more than they should, and a proportion of those have gone on to give up altogether, and as a result they should live much healthier, longer lives. So it's made a huge impact for patients.
The name of our team is the Widening Participation team. We won Team of the Month for designing and organising an evening careers event for local young people to come and find out more about NHS careers and working life within the hospital. And we wanted to do that in a really innovative and inclusive way. We liaised with teams and roles right across the hospital to organise a range of different stands and activities for people to get involved in. We were really delighted with the number of colleagues who came forward and said that they were able to support this event. It was an opportunity for us as an organisation to showcase the really wide range of roles available here, roles which are obvious and easily recognisable, so our doctors, our nurses, our therapy staff, but equally lots of the roles which might be a little bit less obvious to the general public.
The name of our team is the Pacemaker Services team. We won Team of the Month for offering excellent care and services to our patients. The staff were really keen when we heard that there was a safety alert for our pacemaker patients to bring them in as quick as possible. They offered to provide services out of the hours, and we were able to give patients a really good experience. The patients came in and had a full explanation of what the technical problem was, and we were able to reassure them thoroughly with sensible timeframes and talk through how we were changing their pacemakers to make them safe. This incident occurred out of the blue. We were unaware that this was going to happen, so this collaboration was done with a united team, reception, clerical, admin and technical, and we all came together and had to act promptly for this.
The name of our team is the Dementia Co-ordinators. We won Team of the Month in recognition for the work we have done to improve the care of our patients with dementia. We're a 7-day service working across the hospital, and we concentrate on supporting those patients who have complex needs related to their condition. We have embedded the use of the This Is Me document as a tool used by staff daily in the delivery of personalised care, and provide advice and support to staff, patients and their carers throughout the hospital admission. The service provides both mandatory and bespoke dementia training to all staff and volunteers. We have implemented ward-based initiatives to improve the environment and reminiscence-based activities that enhance care on a daily basis.
The name of our team is the Parent Pager Team. We won Team of the Month for introducing a novel set of restaurant-style pages to our day surgery theatre recovery ward. These make it much easier for our staff to get hold of the parents of a child after they've had an operation. So we would always encourage parents and carers to come up to theatre with their child and stay with them in the anaesthetic room until they're safely asleep. Once they are asleep, we can give the pager to the parent, and that means that they can go and get something to eat or drink, bearing in mind that they often are fasting with their child, and then they can be called as soon as their child is safely in recovery, and they can come and rejoin their child after the operation. We found this has made a massive difference, with the reduction in the time the child has to wait for their parent being reduced from 23 minutes down to only 2.8 minutes.
The name of our team is Dayroom to Doorstep Project team. We won Team of the Month for the Dayroom to Doorstep Project, which was introduced as a two-stranded approach to help our patients on Coombe Ward. The patients are encouraged to mobilise into the day room every day to have lunch and take part in a variety of activities, and also the day room is used almost like a discharge lounge. So on the day of discharge, our patients are encouraged to spend some time in there, take part in activities, and then wait for their transport or their tablets to take home. By freeing up bed spaces early in the day, this also helps with flow for the hospital, so patients waiting in A&E are able to come to our ward sooner in the day. We know that encouraging mobilisation is great for our patients, and this project helps to increase their nutrition and their hydration levels and gives them a sense of well-being whilst they're in hospital.
The name of our team is Sterile Services. We won the Team of the Month award because during the refurb that we were having, we were working with limited capacity in our washers. This meant that we had to run a 24-hour service, which was Monday to Friday, so the staff worked extra shifts to ensure that all the work was done for theatres and endoscopy. We processed 200,000 sets per year and approximately 40,000 endoscopes a year. The team were really happy about winning the Team of the Month award. Gave them a real lift. It showed that the trust had seen that they were doing a good job, and they were rewarded for that.
The name of our team is the Paperless Outpatient team. We won Team of the Month for implementing paperless outpatient clinics and removing the need for the paper health record. We worked with the individual teams to make sure that their processes were suitable for them, and initially the teams were a little bit hesitant, sometimes a bit fearful of the change, but actually we've received some really positive feedback now, and it's been great for the environment and clinicians as well, because they've got the information right at their fingertips.
The name of the team is the Saturday team. We were Team of the Month for treating a patient during the summer who required specialist care from lots of different specialties. We set aside a Saturday in July where we performed multiple investigations to investigate the cause of the patient's symptoms. This required a lot of input from multiple specialties, including special care dentistry, oral maxillofacial surgery, and the on-call ENT team who came in later in the afternoon to help with the case. There was quite a bit of preparation from an anaesthetic point of view to administer the anaesthetic safely. The patient had a successful procedure, recovered well from the anaesthetic, and was discharged later that evening.
The name of our team is the Estates Building Team. We won Team of the Month for a call that we took for down the children's ward in the high dependency unit. A patient had caused quite a bit of damage within the room. She had ripped the tiles down off the ceiling, the curtain track was all bent and snapped, and there was a couple of mirrors and things like that we had to remove. But we was able to get there, turn the room round as quick as possible and get the room back up and running for the next patients to come in. Our work covers the majority of things from repairing roofs with roof leaks all the way down to blocked drains, which sometimes are not very pleasant. We try and provide high quality and rapid response time for the other teams within the RUH. We all really enjoy our job and we enjoy working for the RUH, which we try and show in our quality of work and service we provide.
The name of our team is the Organ Donation Team. We won Team of the Month for our performance in organ donation. Organ donation and transplantation is a key part of the NHS because it transforms the lives of those people that receive organ transplants. Lots of people want to donate their organs, but unfortunately, many of them won't die in the circumstances that allows them to do that. As a result, it's a relatively scarce and precious opportunity, and we have to be very sure never to miss those opportunities when they arise. We have done extremely well in that. We've adapted our processes to make sure that we never miss an organ donor or the potential for an organ donation opportunity. We've reformed our processes for consent such that we provide the best possible practice for organ donation. And we're one of only a few trusts in the UK to have a perfect record for that over the past few years.
The name of our team is Helena Ward. We won Team of the Month for the care that we gave to a young gentleman who was on the ward for 3.5 months. The patient was a young guy who was struggling to accept his diagnosis, and we had to work in new ways to help him adjust. That included trialling some drugs that hadn't been used in this country before, which was quite exciting, but also came with a lot of challenges for the patient. So it took a lot of nursing time to build trust with him, and a lot of my staff, including myself, we all adjusted our rotas in order to make sure that there was always somebody on days that we knew were going to be particularly difficult. Trying to plan his discharge was also a little bit of a challenge. So once he was discharged from hospital, the ward remained the point of contact for the patient and also for his family. Care and compassion is at the heart of what we do as nurses, and my team not only showed that to the patient and his family, but to one another. We really took care of each other.